Louisville has a problem with health. Out of the 50 biggest cities in the U.S., Louisville comes in last for overall health and fitness. Now, this isn't a simple issue, but here at Insider Louisville, we're going to shine a light on what's making our city so unhealthy and show you what to do. The issue of health involves a bunch of different things, but in order to improve our city, we need to focus in on just a few. In Louisville, a lot of it comes down to diet, smoking, and fitness. Now, diet has been a problem in Louisville in many ways since the early 1900s, but obesity especially has been a problem since the 60s.
Back in the 1950s and 60s, there were lots of small grocery stores in the neighborhoods, and they were owned by people in the neighborhoods. And the consolidation of the grocery stores also contributed to this, so we had a lot of mom and pops that can no longer survive.
New Roots is an organization in Louisville that provides fresh produce to places without grocery stores, sometimes called food deserts. For Karen, health issues come down to access. That's the main thing that affects diet in Louisville.
So we have this terrible situation in a lot of our urban centers, but also in rural areas where we have flight of grocery stores. So it creates a situation where a lot of people call it food desert. Some people call it food swamps because the fact is there is something there in the neighborhood, but what's there is fast food.
The issue of smoking is a whole other deal. More people in general smoke in the South and Midwest because that's where the tobacco is grown. Half of the country's tobacco farms are located in Kentucky specifically, and that has a big effect on the cultural attitude around smoking. But more importantly, Kentucky has one of the lowest taxes on cigarettes in the country. Here, a $5 pack of cigarettes will cost you $5.60, but in New York, the same pack would cost you $9.35. And taxes do have an impact. In 2015, Kentucky had the highest rate of smoking, while New York had one of the lowest. Finally, fitness.
We have a history of that. It did not occur in a single year or generation. It's taken us a long time to get here. So we have many opportunities to improve our health around the country.
Physical fitness is a focus of the YMCA, but people like Steve Tarver and Karen Chavis agree that fitness is connected to a lot of different things.
So as we look more closely at public health, number one, we got introduced to the important relationship that education has. So we understand that we will not have a healthy community unless we have a well-educated community.
So I think fitness and diet are both important, and I don't mean to diminish one by focusing on another, but I really do think the diet is key.
All of these people say that diet is step one and fitness is step two. So now the question is, what are we and what is the government doing about these issues? Louisville Metro has its health department, and it just got a new director.
So I'm Dr. Sarah Moyer. I am a family physician who started with the health department 2.5 years ago now as the medical director.
She's worked with the department for a long time, and she led the successful syringe exchange program back in 2015. The health department has a plan in place called Healthy Louisville 2020, and anyone can look at it online. They're tackling pretty much every public health issue.
The plan was, I guess, the community coming together and what they wanted to focus on, and so we gave goals and suggestions on how the community could improve it, and so been partnering and tackling it almost like one step at a time.
So where are they at with this plan?
So it's been almost all over the board. We've made great progress in some areas like access to care, and then there's other areas like obesity that have gone the wrong direction.
She's right. The city tracks their progress publicly online, and for a lot of it, it doesn't look that good. Like Dr. Moyer said, obesity rates have gone up, but Dr. Moyer says that smoking is one area that has improved.
Here at the health department, I guess over the last couple of years, we really dove into smoking, for example, for one. In 2005, the first smoke-free ordinance was passed, and then after that, we added e-cigarettes for minors in 2014. You weren't allowed to sell e-cigarettes to minors in 2014, and then just this year in 2017, we added e-cigarettes and hookah.
A way to decrease rates even further would be to raise taxes on cigarettes. Here's where we have one major roadblock.
Kentucky is unique in that our laws can't be stronger than the state laws, is how I've been told. I'm not a lawyer, but we can't look at any local tax until the tax structure on the state level is changed.
This is clearly a huge obstacle. Kentucky is one of 16 states where cities cannot impose their own sales tax. Mayor Fisher wants to change this because he supports local option, a move to get local sales tax that would fund certain projects. The health director says if they could raise the taxes, they would. The government has improved on smoking, but diet and fitness are another story. Dr. Moyer says that the health department has focused mostly on diet.
It's also a huge risk factor for all health outcomes: diabetes, heart attacks, strokes, COPD, everything. And so anything about changing that system to have access to healthy food is definitely something the health department's looking at.
She sees fitness going hand in hand with diet, but she also says that things like violence reduction is a focus that would lead to safer communities where people would be more willing to exercise.
The government has been very good about being both a convener and a reflection of some of these grassroots and organic movements that are popping up around the area of health in our region.
Steve Tarver with the Y works a lot with the government and says that a few years ago they put in place an initiative to get fresh produce in corner stores around downtown Louisville. But this initiative hasn't had momentum in a few years. Karen Moskowitz, CEO of New Roots, does agree with Dr. Moyer's overall focus, but she says that the government isn't doing enough.
If the city was serious about health equity and understood that fresh food is one of the basic building blocks of health, we would get not only funding and support in the budget, which we don't get, we would also get full support with outreach and media and, being invited into spaces. The community has to organize amongst ourselves to then be able to push Louisville Metro toward true health equity and food equity through a local food policy council.
Karen says that New Roots and other grassroots organizations have the tools and systems to make a change in food access, and that the government needs to set up a council with representatives to help make the activism on a grassroots level a reality. Dr. Moyer says that she and the health department are all for ideas like this, but Karen says that in the past, she hasn't seen that coming from the health department. Another important thing to mention, 3 major international fast food companies, Yum Brands, KFC, and Papa John's, all have their headquarters in Louisville. Karen says this has some major effects on culture and attitude towards food in the city. Clearly, there's a disconnect in communication between the city government, grassroots organizations, and the people of Louisville. There's one huge part in this that up until now we've left out: the socioeconomic inequalities that affect overall health.
We're learning more and more that health is not just about those healthy behaviors that you do, but your zip code can determine your health.
A big problem in Louisville especially is segregation. The neighborhoods in West Louisville are more than 60% black, while East End neighborhoods are more than 90% white.
So there was a report that was just done that showed that there was redlining as far as real estate, so who could live where. And so that's why we have so many people of color concentrated pretty much in just certain neighborhoods. It's creating a really dangerous situation.
What Karen is talking about is redlining. Redlining is when investors refuse a loan to someone because of a perceived notion of poor finances. And earlier this year, a project came out showing that redlining with housing is what created the problem with segregation that faces Louisville today. This project was done by Joshua Poe.
So redlining was a grading system for capital lending in neighborhoods. And what that did was it really inhibited people's ability to create wealth, because most of the places that were redlined were places where black people lived, and they were redlined solely because black people lived there.
Government officials would mark neighborhoods into 4 categories, and neighborhoods in the lowest category would not receive investment, while the highest category would receive overinvestment. This was purely on a racial bias, and it created today's problems.
Men like Harlan Bartholomew and early planners would actually sit down and analyze a city and try to predict where African Americans would move in that city. They would then zone those areas industrial. So they would ensure that African Americans were going to live in industrial areas or near industrial areas for the next 100 years.
This is a call to action. It means a few different things to Poe.
It's important to study those lessons from the past, so that we don't make the same mistakes. I think by acknowledging the research the public officials and local government has a real responsibility to reinvest in these areas. I think that's sort of a major first step. There are 3,000 vacant properties in West Louisville, give or take a few. We could reduce that by a third. So I think a logical plan that the city could take on would say we're going to rehab 1,000 vacant properties in the next 3 years.
We haven't really come to terms with how our institutions have contributed to health inequity.
But there is a government organization addressing this issue specifically.
We really talk about the work that we do in the Center for Health Equity, as I like to describe it, everything that people think has nothing to do with health. So those are those root causes: economic development, neighborhood development, educational development, our food systems.
Louisville Metro's Center for Health Equity was the first of its kind in the country. And since it was started in 2006, they've made some progress.
Specifically in the center, we've got 3 initiatives, and that is community capacity building, youth engagement and development, and environmental justice.
In the community capacity area, they release a health equity report every 3 years that looks at where the city is at on different social determinants of health. For environmental justice, they're at the table when policy is made, and they weigh in with the equity point of view.
In the past, we've had a program, a vibrant program called Healing Future Fellows program, where we had young people come over the summer, 25 young people that were with us over the course of 4 summers. This summer, we created our Racial Equity Youth Council, and so they're actually creating plans that will change systems and policies for 16 through 24-year-olds in the city.
The center's priority is highlighting what's wrong and influencing other departments of the government. Dr. Pryor recognizes the issue with vacant properties, and when legislature is enacted, she brings the context of health to the table. Solving health issues and reducing inequity is clearly a complex problem. The Center for Health Equity was put in place to help the city move in the right direction. So, to recap, the government's made good progress on smoking, but little progress on things like reducing obesity and improving food access. Grassroots organizations want more collaboration and more transparency with the health department. And city government wants the ability to impose taxes on things like cigarettes and soda. And these, of course, aren't the only things affecting health in our city. There's a lot of issues with clinical care, housing, and substance abuse that people in the city are making strides towards improving. But all of this is connected to Louisville's long-standing inequity that comes from systematic housing discrimination. Now, what needs to happen next? I'm going to take a tiny step back from the unbiased journalist point of view and tell you what I really think as a citizen of Louisville after doing all of these interviews and this research. First, congratulate ourselves on our progress. The government's WIC program, New Routes Fresh Stops, Mayor's Healthy Hometown Grants. These are great marks of progress that are unique to Louisville and show what great potential that we have. But next, we need to take steps in our personal lives. It's easy to just tell government what to do, but all of that gets lost in the bureaucracy and in the back and forth with different organizations. I'm with Josh Poe on what the next steps need to be.
Personally, I don't really think that local government or private entities are going to take those things on alone. I think that the redlining project can be used as a tool at the grassroots level for activist movements and local organizations to hold government accountable.
To really make a change, regular citizens need to pay attention to this research and join in. Call in and demand that Kentucky enable local taxation on things like cigarettes and soda. Make Louisville Metro renovate vacant properties to reinvest in the West End. Demand a local food policy council to avoid losing grocery stores. All of these problems with public health are built into a system that is outdated and unfair. There's a lot that Louisville has to be proud of, but even more that we can do to make a change.